Teacher Eliza.
And I am Teacher Sandy.
And I am Teacher Mac.
We are the teachers for today's discussion.
And we will be hoping that this session will be productive and full of learnings.
Okay, once again, good day learners. So before we start a discussion, let us have our first activity. So you will be motivated by the ADMI game. But before we start, let me read first the instruction. So please class, listen carefully. So I will present two separate pictures and you will guess the correct answers by adding the two pictures. And after that, I will select two students to answer the questions based on the activity. Okay, class, are my instruction clear? Okay, very good. Okay, I think everyone is ready. So let us start. Okay, the first picture. Okay, the correct answer is caregiving. Okay, very good. Now let's proceed to the second picture. Okay, the correct answer is thermometer. Okay, the third picture. Okay, the correct answer is dishwasher. Okay, let's proceed to the fourth picture. Okay, the correct answer is dustpan. Okay, let's proceed to the last picture. Okay, the correct answer is airpot. Okay, very good learners. You got the correct answers. So now I will select 3 students to answer the question. Okay, first, Ochia. What can you say about the activity? Okay, very good. Now I will select Joseph to answer the second question. Okay, your question is, based on the picture, what does it imply? Okay, very good, Joseph. How about Salilim? How do you think these pictures represent the importance of caregiving? Okay, very well said.
Now we will go further to activity 2. Class, please get one whole sheet of paper and I will be presenting a random pictures about the caregiving tools, equipment, and paraphernalia. And then you will identify them based on their classification, if it is used for meal preparation, used for cleaning, laundry, and ironing, and used for taking vital sign through using a table. So let's start. Okay. Okay then, class. So pass your paper.
Okay, since we have done with the second activity, so now let me ask you this question. Okay, first question. Based on your activity class, what is the importance of classifying caregiving tools, equipment, and paraphernalia? Okay, what a great answer! How about question number 2? How does caregiving important to our daily life? Okay, very good observation, class. Next question. Have you ever experienced taking care or providing healthcare with someone? Okay, very good. That's a wonderful experience you have shared in the class. How about the last question? What are the essential skills for a caregiver to have? Okay, what a nice idea. I hope, class, that you have learned something from our activities. I know that you already have an idea for today's discussion, which is about caregiving tools, equipment, and paraphernalia. But before we go further to our discussion, let me read you first the objectives. So at the end of the lesson, the students or the learners will be able to, first, identify tools, equipment, paraphernalia used in caregiving services. Second, perform the proper caregiving using tools, equipment, and paraphernalia. And the third, value the importance of proper usage and benefits of caregiving tools, equipment, and paraphernalia. So class, our topic for today is about caregiving tools, equipments, and paraphernalia. So one of the most important tasks of a caregiver is to make sure that he or she uses the right equipment, tool, and paraphernalia that is applicable to a specific job. You, as a future caregiver, therefore should be well versed with the different tools and equipment that you will use when you are already in the healthcare profession. Okay, so first let us discuss the different tools, equipment, and paraphernalia used in milk preparation. So first we have the air pot. So what is an air pot? So an air pot is a vessel usually rounded which is used for holding liquid to maintain heat or coldness. Caregivers may use air pots to keep hot water readily available for dissolving medication, particularly for individuals who have difficulty swallowing pills or need their medication in liquid form. Next, we have a blender. So what is a blender? So a blender is a kitchen and laboratory appliance which is used to mix, puree, or emulsify food and other substances. Caregivers often need to ensure that the individuals they care for have a balanced and nutritious diet. A blender can be used to prepare smoothies, shakes, or purees that incorporates fruits, vegetables, proteins, and other ingredients. This can be especially helpful for individuals with swallowing difficulties or those who requires a soft or liquid diet. Okay, next we have coffee maker. So what is a coffee maker? So a coffee maker is an electric countertop appliance that roasts hot coffee automatically. Next, we have chopping board. So what is a chopping board? So a chopping board is a flat wooden or plastic board where meats or vegetables can be cut. Next, we have electric knife. So an electric knife is a kitchen device which is used for slicing food. It requires less physical effort than ordinary knife and makes neater slices. In addition, electric knives provide more control and precision when cutting, which can be beneficial when working with delicate or intricate food items. This can be especially important in caregiving services where dietary restrictions or specific portion sizes need to be adhered to. Next, we have electric can opener. So an electric can opener is a very useful device which is used to open canned goods with ease and accuracy. Then next we have the food processor. So a food processor is a multitasking tool which is used to slice, dice, or whip food ingredients. In addition, a food processor can quickly chop vegetables, fruits, herbs, and other ingredients, saving time and effort compared to manual chopping. This is particularly beneficial for caregivers who may need to prepare meals for multiple individuals or those with limited time. Another one we have the food tongs. So what is a food tongs? So a food tongs is an instrument with two hinged or sprung arms for grasping and holding. Next we have a ladle. So what is a ladle? So a ladle is a long handled spoon with deep bowl at the end for serving food. Next we have stove. So a stove is an appliance in which electricity or gas is utilized to supply heat to be used for cooking or preheating. So those are the different tools, equipments, and paraphernalia used in milk preparation. I hope that you have learned something from my discussion class.
So now we will go on to the next slide, which talks about the tools, equipment, and paraphernalia for cleaning, washing, and ironing. So when it comes to cleaning, washing, and ironing, there are various tools, equipment, and paraphernalia that can make the task easier and more efficient. So here are some essential items you may need. First is the bottle sterilizer. So the primary function of bottle sterilizer is to eliminate the bacteria, viruses, and other pathogens that may be present on baby bottles and related items. Sterilization is typically achieved by using high temperature, steam, or ultraviolet light. Next is broom. So the primary function of a broom is to sweep and collect dust, dirt, and debris from floors, sidewalks, or other surfaces. It helps to keep the area clean by effectively gathering loose particles into a pile for easy disposal. Next is the clothes hanger. So the primary function of a hanger is to provide support and structure to clothing items, allowing them to store in a hanging position. Next is the dishwasher. So the primary function of a dishwasher is to clean and sanitize dishes and kitchenware. It uses combination of water, detergent, and jets or spray arms to remove food residue, grease, and stain from the dishes. Next is dryer. So the primary function of a dryer is to remove moisture from wet laundry and accelerate drying process. It uses combination of heated air and tumbling action to evaporate the water from clothes. Next is the flat iron. So the primary function of a clothes iron is to smooth out the wrinkles and creases in fabrics by applying heat and pressure. It helps make the clothes appear net, presentable, and more professional. Next is the iron board. So the primary function of an ironing board is to provide a flat and padded surface for ironing clothes. It allows for easy access to fabric and it helps in achieving smooth and wrinkle-free result. Next is a vacuum cleaner. So the primary function of vacuum cleaner is to remove dirt, dust, and debris from floors and surfaces by creating a suction. Lastly is the washing machine. So the primary function of a washing machine is to wash and clean the laundry by agitating it with water, detergent, and sometimes other cleaning agents.
Okay, next, let us discuss the different tools, equipment, and paraphernalia for taking vital signs. So first, we have the BP apparatus aneroid sphygmomanometer. So an aneroid unit is mercury and free consists of a cup that can be applied with one hand for self-testing. A stethoscope that is built in or attached and valve that inflates and deflates automatically with the data displayed on an easy-to-read gauge that will function in any position. So it is important to note that accurate measurement and interpretation of blood pressure required proper training and technique. Caregivers should receive appropriate instruction on using the aneroid sphygmomanometer correctly and interpreting the result accurately to ensure the highest level of care and safety for their clients. So next, we have the BP apparatus mercurial sphygmomanometer. A mercury-based unit has a manually inflatable cuff attached by tubing to the unit that is calibrated in millimeter of mercury. During the blood pressure measurement, the unit must be kept upright on a flat surface in the gauge, read at the eye level. So it is important to note that accurate measurement and interpretation of blood pressure require proper training and technique. Caregivers should receive appropriate instruction on using the aneroid sphygmomanometer correctly and interpreting the result accurately to ensure the highest level of care and safety for their clients. So next, we have the BP apparatus digital sphygmomanometer. So a digital unit is mercury free and consists of the cuff that can be applied with one hand for self-testing. A stethoscope that is built in or attached and a valve that inflates and deflates automatically with the data displayed on the LCD. So it is important to note that while digital BP apparatus can provide accurate readings, So it is advisable to consult with a healthcare professional for proper interpretation and guidance on blood pressure management. So next we have the stethoscope. So a stethoscope, it is an instrument which is used for listening to the action of the heart, lungs, etc. So usually consisting of a circular piece placed against the chest with tubes leading an earpiece. So overall, the stethoscope plays a critical role in caregiving services by enabling healthcare providers to gather essential information about patients' health status, identify potential issues, and make informed diagnostic and treatment decisions. So next, we have the thermometer. So a thermometer is an instrument for measuring temperature. So overall, thermometer play a critical role in caregiving services by enabling caregivers to monitor body temperature, detect early signs of illness, administer medication effectively, and maintain a safe environment. And lastly, to ensure the well-being of the individuals under their care.
So now let's go further with the abstraction part, which talks about the proper usage of tools, equipments, and paraphernalia used in caregiving services for meal planning. So now let us discuss the procedures or steps on how to operate a microwave oven. So first, you have to plug the microwave oven. Second, open its door, put the food you want to cook inside it, and close it. Third, set the time that you want to microwave something for. And fourth, if it is done, open the door and grab the food out of the oven. And fifth, the last steps is to clean and unplug the microwave oven. Okay, next we have the electric can opener. So how to operate an electric can opener? So first, you have to plug the electric can opener on outlet. Second, lift the lever that raises the cutting wheel into the air and place the lip of the can under the wheel. And put the lever down and press hard enough so that the wheel gets into the can. Third, turn on the opener while holding the bottom of the can and it will automatically turn as the wheel slices through the can. Fourth, remove the can from the opener when it reaches the end and you feel a slight drop of the can. The lid will remain attached to the magnet on the opener but the can is ready to dock. Fifth, unplug the opener from the outlet. So next we have the stove. Okay, so how to operate a stove? So first, push in the control knob for the burner you would like to use and turn left to the light position. The clicking noise means electric ignition is activated. Second, immediately after the control knob's burner lights, turn the knob right until you get the flame height you want. Third, or the last step, is you have to turn the burner off, turn the control knob right to off position. So next we have air pot. So there are 4 procedures or 4 steps on how to operate air pot. First, you have to rinse out your air pot prior to filling it. Even it has been cleaned recently, go ahead and give it a little rinse. If the air pot have been sitting close, it could have retained a slight odor. Rinsing will give your coffee hot water or half and half a fresh start. Second, close the lid and adjust so the guest can use the pump feature. With some airpods, you have to physically lift the pumping mechanism that is attached to the lid. Others have a push button that activates to bump or to pump with no adjusting necessary. Third, refill if necessary. Airpods have a pretty distinctive empty sound when someone has pumped out the last of the liquid inside. The customer will usually tell you when you need to refill the pot. Fourth, clean your air pot carefully. These are made with glass insulation that has been vacuum sealed into the containers. You can just toss them into a dishwasher or a sink full of dishes. If you do so, they may break. Okay, remember that one. The best way to clean air pots is to rinse them well with hot water and add a teaspoon of baking soda. Fill it back up with hot water. Soak the air pot overnight and with the lid ajar. Next, we have the electric knife or the electrical knife. So there are 4 procedures or steps on how to operate electrical knife. So first, before using an electric knife, you must clean its blade first. Okay, so the second one, if it is already clean, touch the button and put the blade in the food to make it cut. Third, then if the food is already cut, remove your finger at the button. And the fourth or the last step, after use, clean the blade and put it back in the container.
So now we will proceed to the proper usage of tools, equipment, and paraphernalia used in caregiving services for cleaning, washing, and ironing. So, it is essential to ensure efficient and safe operation. Here are some guidelines for their proper usage. First is the flat iron. Proper usage of flat iron, also known as clothes iron, is important to achieve effective and safe result when ironing clothes. Here are some guidelines for the proper usage of flat iron for clothes. First is ensure that the flat iron is clean and in good working condition. Next is to fill water reservoir if your iron has steam function. Next is to set up the ironing board on a stable surface and adjust the height if necessary for comfortable ironing. Next is to check the fabric care labels on the clothing items you are going to iron. Next is to start with garments that require lower heat setting progressing to higher setting for sturdier fabric. Place the garment on the ironing board, smoothing out any wrinkles or creases. Slowly, steadily move the iron over the fabric straight, smooth stroke. So if there are any particularly stubborn wrinkles, you can go back and forth over them a few times or use the tip of iron to focus on specific areas. So after ironing, carefully move the garment to flat surface on the ironing board to prevent wrinkling. Be cautious of hot sole plate to prevent burns or injuries. Always unplug the iron and allow it to cool down before storing it. Secondly is the proper usage of butter sterilizer is important to ensure effective sterilization of baby bottles and related equipment. So here are some guidelines for the proper usage of bottle sterilizer. Preparation stage. Clean the bottle, nipples, and other feeding accessory thoroughly using warm soapy water. Rinse them well to remove any soap residue. Disassemble the bottles and remove any removable parts such as nipple, bottles, and ring. Ensure that the sterilizer is clean and in good working condition. Following manufacturer's instruction. Read and understand the manufacturer's instruction for your specific bottle sterilizer model. Different sterilizer may have different feature and operating procedure. Next is to place the disassembled bottle, nipples, and other feeding accessories inside the sterilizer. Make sure they are arranged in a way that allows steam to reach all surfaces. Avoid overcrowding the sterilizer to ensure proper steam circulation and effective sterilization. If your sterilizer has separate compartments for different accessories, follow the instruction to load them correctly. Use distilled or filtered water if recommended by the manufacturer to prevent mineral buildup. And be careful not to exceed the maximum water level. Close the lid or cover of the sterilizer securely. Start the sterilization cycle and allow the sterilizer to complete the designated time for effective sterilization. Cool down and drying stage. Once the sterilization cycle is complete, wait for the sterilizer to cool down before opening it. Carefully remove the sterilized item from the sterilizer, ensuring the proper hygiene by washing hands or using clean utensil. You may you may let the items air dry, or if your sterilizer has a drying function, follow the instruction for drying the bottles and accessories. For the storage, store the sterilized bottles and accessory in a clean and dry area. Lastly is the proper usage of washing machine. So the very first step in washing is sorting the clothes of your client. Separate white and light colored from the dark colored clothes. Also, they should be sorted according to their materials. Wash clothes with heavy fabrics together and clothes with light fabrics together. Put the detergent into the washing machine. Put the clothes loosely in the washing machine. Load the laundry as high as the manufacturer specify or to the top row of the hose in tub. Close the lid and choose the setting of the washing machine according to what you are washing. Turn on the washing machine, let the unit work through all the cycle. Wait for the washing machine to turn off before you unload. Load the next batch of clothes and do the steps 5, 6 again until you are done with the laundry. Turn off and unplug the unit.
Okay, next, let us discuss the procedure of common equipment in taking the vital signs. So when caring for an infant, toddler, child, and elderly, or person with special needs, measuring the vital sign is of utmost concern. So this is also a concern of your client. Hence, he or she has the right to know her vital signs. So first, we have the thermometer. So body temperature is a measurement of amount of heat in the body. The balance between heat produced and heat lost in the body temperature. So the normal adult body temperature is 37 degrees Celsius. So there is normal range in which a person's body temperature may vary and still be considered normal. So take a look at this normal range of body temperature. So first we have the oral, 36.4 to 37.2 degrees Celsius. Next is rectal, 37 to 37.8 degrees Celsius. Next is axillary, 35.9 to 36.7 degrees Celsius. The following are the different types of thermometer. So first, we have the clinical thermometer. May be inserted either into the rectum through the anus, rectal temperature, into the mouth under the tongue, oral or sublingual, or armpit, axillary temperature. It is made of glass with a narrowing above the bulb so that the mercury column stays in position even when the instrument is removed. The use of this type is now being eradicated as the mercury content is dangerous to people. Next is digital thermometer. May be inserted into the mouth, under the tongue, under the armpit, or into the anus. So this thermometer displays the reading in the LCD. This type of thermometer does not use mercury, which is hazardous to humans. That is why more and more people are using it now. Also, using this thermometer is simple, quick, and effective. Next is air digital thermometer. Measures the heat coming from the eardrum. This release of heat is converted into a temperature and displayed on a LCD. It is very easy to use this. You just have to place the tip in the ear of a person. Press the button and in a few seconds, the measurement is seen on the LCD. Next is infrared thermometer. With laser pointer, measures temperature using thermal radiation emitted by the body. It is also called laser thermometer. If a laser is utilized to aid in aiming the thermometer, others call it non-contact thermometer because of its ability to measure temperature from a distance. It provides temperature reading without physical touching the object. all you have to do is aim the object as in the forehead. Pull the trigger, and immediately you can see the temperature reading of the LCD. So now, using a digital thermometer, rectum through the anus. So next, let us know the steps using a digital thermometer, rectum through the anus. So first, wash your hands and take the thermometer out of its holder. Second, clean the probe, pointed end of the thermometer with rubbing alcohol or soap, then rinse it in cold water. Third, put a probe cover over the pointed end of the thermometer. If your thermometer did not come with a probe cover, then you can use it without one. Fourth, lubricate the end of the probe with a small amount of lubricating jelly. Fifth, place your child. Taking the temperature through the rectum is usually done on children. On his stomach, across a firm surface on your lap before taking his temperature. 6. Gently slide the probe of the thermometer into the rectum about a half inch. Stop inserting the thermometer if it becomes difficult to insert. Never force the thermometer into the rectum. 7. Continue to hold the thermometer the entire time you are taking the temperature. Always stay with your client while taking the temperature. 8. Keep the thermometer in place until it beeps, then remove the thermometer. 9. Read the numbers on the LCD. These numbers are your client's temperature. 10. If you use a probe cover, remove it and throw it away. 11. Wash the probe of the thermometer with soap, water, and rubbing alcohol when you are done. Put the thermometer tip cover. Place the thermometer in its holder or container. 12. Record the reading. And last, wash your hands. Okay, next, let us know the steps using a digital thermometer on mouth. So first, wash your hands and take the thermometer from its holder. Second, clean the probe, pointed end of the thermometer with rubbing alcohol or soap and then rinse it in cold water. Third, inform the client that you're going to take his temperature orally. Fourth, ask the client to wet his or her lips and pick up his tongue. Fifth, place the thermometer under the client's tongue on one side of his or her mouth. Ask him or her to close his or her lips. You may have to hold the thermometer, especially if your client is sick and weak enough to even hold the thermometer with his or her lips. 6. Leave the thermometer in place until the thermometer signal it is finished. When it beeps, it signifies that it can be removed. 7. Remove the thermometer carefully and read the temperature on the digital display. Clean the tip of the thermometer with a cotton ball soaked in alcohol. Put thermometer tip cover. Place the thermometer in its container. And last, record the reading and wash your hands. Okay, next, let us know the step using a digital thermometer on armpit. So first, wash your hands and take the thermometer from its holder. Second, clean the probe pointed end of the thermometer with rubbing alcohol or soap and then rinse it in cold water. Third, inform the client that you are going to take his temperature under the armpit. Fourth, place the thermometer under the client's armpit. You may have to hold the thermometer, especially if your client is very sick and weak that he or she cannot even hold the thermometer with his or her armpit. Fifth, leave the thermometer in place until the thermometer signal it is finished. When the thermometer beeps, it means that it can be removed. And 6, remove the thermometer carefully and read the temperature on the digital display. Clean the tip of the thermometer with a cotton ball soaked in alcohol. Put the thermometer tip cover. Place the thermometer in its container. 7. Record the reading and wash your hands. Next is BP apparatus. Another important measure that you should learn to take the blood pressure. Blood pressure is the force of blood pushing against the walls of the blood vessels. The heart contracts as it pumps blood into the arteries. When the heart is contracting, the pressure is highest. This pressure what we know as the systolic pressure. Now as the heart relaxes between each contraction, the pressure decreases. When the heart is most relaxed state, the pressure is lowest. And we call this diastolic pressure. The following step will help you measure blood pressure accurately. So first, wash your hand and prepare the equipment you will use. Second, introduce yourself and let the patient or client know the procedure to be done. Third, sanitize the earpieces of the stethoscope with an antiseptic pad. Fourth, ask your client to rest quietly. Have him or her lie down or sit on chair when whichever is more comfortable for him or her. Fifth, if you are using mercurial apparatus, the measuring scale should be within the level of your eyes. Sixth, expose the arm of your client by rolling the sleeves up. Have your client's arm from the elbow down to rest fully extended on the bed or the arm of a chair. 7. Unroll the cuff, loosen the screw, and squeeze the cuff with your hands to remove air completely. 8. Wrap the cuff around your client's arm, above the elbow, not too right or too loose. 9. Find your client brachial pulse at the inside of the elbow. Hold the diaphragm there and inflate the cuff until the pulse disappears. Take note of the reading and immediately deflate the cuff. This is the client approximate systolic reading and it's called the palpated systolic pressure. 10. Place the stethoscope or pieces into your ear and place the diaphragm on the brachial pulse. 11. Turn the screw to close it. Inflate the cuff until the dial points to 30 mm above the palpated systolic pressure. 12. Turn the screw to open it. Let the air escape slowly until the sound of the pulse comes back. Take note of the calibration that the pointer passes as you hear the first sound. This indicates the systolic pressure. 13. You must continue releasing the air from the cuff. When you hear the sound change to something softer and faster and disappear, take note of the calibration. This is now the diastolic pressure. 14. Deflate the cuff completely. Remove it from the arm of your client and record the reading on the client's chart. And last, wipe the earpieces of the stethoscope with an antiseptic pad and place the equipment back to their proper place and wash your hands. Okay, that ends for the abstraction part. I hope that you listen carefully and you learn something from our topic that will be helpful for your future references. For the application part, I will divide into 4 groups and I will provide 4 equipments, tools, and paraphernalia. So each group will identify and perform the proper usage of caregiving, tools, equipment, and paraphernalia based on the given situation.
For the group 1, you have to prepare apple and mango smoothie. Group 2, you have to sterilize feeding bottles. Group 3, you have to iron shirt and pants of the client. And for the last group, group 4, you have to take temperature reading. So you will be graded based on the given rubrics.
Correct handling. The group demonstrates proper handling and usage of tools and equipment, such as using the correct setting on the blender, placing items correctly in the sterilizer, using the right temperature setting on the flat iron, and using the thermometer correctly. A total of 25%. Efficiency. The group demonstrates efficient use of the equipment or tool, minimizing the time required to complete the task while ensuring the safety and quality care. A total of 25%.
Communication. The group effectively communicates any necessary information, such as setting or operating instructions, to others who may use the tool or equipment. 25%.
For the accuracy, the group demonstrate the ability to use the tool or equipment to produce a quality outcome, 25%.
A total of 100%. You may now go to your respected groups and you may now start. Just enjoy and do your best.
To assess your learnings, we will be having a 10 items multiple choice, and for the instructions, you just have to read and understand each question carefully. And then you have to encircle the correct letter that corresponds to your choice. Okay, write your answer in the quiz notebook and I will give you 25 minutes to answer. Okay, so let us check your answer. Number 1. What type of thermometer uses mercury and therefore is considered unsafe to use? Okay, the correct answer is letter D, clinical thermometer. Number 2. Which of the following is not proper when operating a blender? The correct answer is letter B, plugging the blender first before putting the pitcher onto the base. Number 3. What is the balance between heat produced and heat lost in the body? The correct answer is letter B, body temperature. Number 4. What kind of temperature when the thermometer is placed under the armpit? The correct answer is letter C, axillary temperature. Number 5. What should be checked before ironing, as some fabrics need special care instructions? The correct answer is letter A, labels of the garments to be ironed. Number 6. What type of appliance is useful especially at mealtime? The correct answer is letter A, blender. Number 7. What type of pressure thus heart is contracting, the pressure is highest? The correct answer is letter A, blood pressure. Number 8. What kind of caregiving equipment in meal planning use magnet so that the lid will remain attached to it? The correct answer is letter D, electric can opener. Number 9. What is the fifth vital sign? The correct answer is letter B, pain. Number 10, the last number. Which of the following tools is used for listening to the action of the heart and lungs? The correct answer is letter B, stethoscope. Okay, class, who got the perfect score? Okay, very good, class. Lahat kayo naka-perfect. So for your assignment, class, research and print the dosage calculation conversion for medical dose. The deadline will be on Monday.
Thank you for attending our session for today, learners.
Hope you will gain knowledge about proper usage of caregiving tools, equipment, and paraphernalia.
Once again, I am Teacher Macquinero Claret.
I am Teacher Eliza C. Mahumot.
And I am Teacher Santa Claire B. Masayon,
Your house teachers.